Hi, my name is Angela Gutierrez, and today we are going to talk about asthma.
So, before we actually get started, I felt it was really important for us to recap on the respiratory system. That way, whenever we actually get into the dynamics of asthma, a lot of the structures in the lungs will make a lot more sense. So, as you can see in the picture there on the left, air is inhaled through your nose or your mouth. It goes through your trachea or windpipe down to the bronchial tubes, the bronchus, and the alveoli. The alveoli are actually little tiny sacs, and that is actually what is responsible for the gas exchange, carbon dioxide for oxygen. Now, whenever we exhale, that's how we get rid of the carbon dioxide. And again, in reverse, it goes up through the bronchioles, bronchial tubes, trachea, windpipe, and is exhaled either through our nose or our mouth. Okay, now let's get started on asthma.
Asthma is a chronic lung disease that affects your lungs and your airway and its ability to exchange air in or out. Asthmatics have a pretty unique inflammation in their airway caused by hypersensitivity to allergens such as grass, mold, dust mites, carpet, pets, even cold air. Stress can cause asthma in some people, chemical exposures, and some people also have what's called exercise-induced asthma, meaning they're not typically allergic to other things, but only have exercise that causes those triggers. And what happens is the airway swells and tightens, and it causes the airway to become restricted where you can't get that air in and out. Now, the airway system is lined with smooth muscle, fibrous smooth muscle, and it also constricts. So you kind of have all these issues coming from different directions. The symptoms that someone experiences with an asthma attack is wheezing, coughing, increased mucus production, and anxiety. So right now, let's take a look at this video, and it's a really quick clip to kind of give you an idea what that constriction looks like in the lungs.
Causes the airways to narrow and swell, resulting in wheezing and difficulty breathing.
So now we're going to talk about how asthma is diagnosed. First, you'll notice that you have to make your physician appointment because you have recognized some symptoms. Now keep in mind also that what your doctor is going to do is he's going to grade the severity or kind of classify your asthma, which, you know, the severity is not really anything to concentrate on. It's just kind of a guide. It's the control that matters. And so the doctor's going to do a questionnaire of some symptoms. It's called an asthma control test is one of them. And it determines if your asthma is well controlled. Now, if this is your initial visit, of course, you're not going to have medications and it's not going to be controlled. But you will have continual visits because remember, this is not a disease that is curable. So the asthma control test is one. The physical exam, listening to your lungs, discussing your overall health. A chest x-ray is not necessarily done for the asthma to look at your lungs. It's done to rule out other possible causes of your asthma. The next thing that the doctor may do is order a pulmonary function test, and there's a couple of them, and both of them are good. A spirometry, it estimates the narrowing of the bronchial tubes and how much you can exhale after breathing out. The next one is the peak flow test. You can see the meter there at the bottom. That actually measures how hard you can breathe out, and low readings indicate asthma is getting worse. So this is something that some people actually keep at home in order to monitor, whether their asthma is getting worse. One really helpful thing is allergy testing, and you can either do skin testing or blood testing. Skin testing is real reliable also, and it helps you as you continue with asthma know what triggers to stay away from. For instance, if it's grass or pets or carpet, then that will help you decrease your symptoms, and help you live a better life. So another thing is exercise and cold. The doctor could measure your airway obstruction measuring before you do the excessive exercises, and then he'll have you do some, rigorous exercises to, make you breathe harder, and then measure it again in order to calculate that. So another thing that your doctor will do, like I discussed about, the grading of severity, is, one of them is intermittent asthma. And this means, it's kind of hit or miss. It's, you don't have very many symptoms. It's, no more than 2 days a week. And you might have nighttime flare-ups 1 to 2 times of a month at most. And anything more than 2 times a week is no longer intermittent. Then you kind of move on to something a little more persistent, which is mild persistent asthma. More than twice a week, but not every day. So this flare-up of symptoms might affect activity, running, riding your bike. Nighttime flare-up is more than twice a month, but not more than once a week. And they typically say at this stage your lung function is about 80%. Now, moderate persistent asthma symptoms occur daily. So this really affects someone's quality of life. And flare-ups last several days. Coughing, wheezing disrupts normal activities. It makes it very difficult for someone to sleep, to work, to, have any kind of quality of life. And nighttime flare-ups are more than once a week. At this point, your lung function is about 60 to 80% without treatment. And then severe persistent asthma is the 4th level, and symptoms occur daily and often in children, or in anyone. It affects most all of your activities and disrupts sleep, and the lung function is less than 60% without treatment. This is the most severe. It's also the least common. Anyone who has trouble breathing wants to have this under control. And so, again, the goal to any of this treatment is to control the airway symptoms and swelling, stay away or guarded from your triggers like allergens or, grass or mold. Get that test to measure your lung function. And the other tests that, the doctor orders, and in combination, all of that helps diagnose and also works towards your treatment and what's best for you. And we'll discuss that in the next slide. So now we're going to start with the first line of defense treatment, which is a rescue inhaler. This is not at all a medication to be used in the maintenance of asthma. This is only what you might have heard the term of an asthma attack. This is like a rescue inhaler that someone carries with them whenever they have symptoms of, the swelling and closing off of the airways and stuff. So the bronchodilator relaxes the muscles in the airway. Remember, the trachea and the bronchioles are wrapped in that smooth muscle, and that starts to constrict and get tight. So the bronchodilator does not control inflammation. It only relaxes that muscle in the airway, opening that up so that air can move freely. It acts within minutes, and the duration is several hours, depending on how specific they are. Usually it's anywhere from 2 to 4 to 5 hours. It just depends on the medication, and you have to review that with your pharmacist. The inhaler is most convenient because you can carry it with you anywhere you go. A nebulizer is another form of a rescue B2 agonist, and most people use those at home because you have to use an electrical source to plug it in, but it is efficient, and it is classified as a B2 agonist for rapid relief. These rescue inhalers can also be used for those who have asthma, the exercise-induced asthma, and this prevents an asthma incidence. So on medications, you see that there's 3 that I have listed there: salbutamol, and a couple more that I don't have listed that are real common is albuterol and terbutaline. So some of the side effects is increased heart rate, shaking, kind of like shaking of the hands, or feeling kind of nervous, but that does pass pretty quick. And remember that when taking these rescue inhalers, it's really important to keep track and kind of keep note of how often you're using it, because if you're using it more than twice a week, it's time to see your doctor because your asthma is no longer being well controlled. Okay, so with step two, this is whenever the first step with persistent asthma, you're starting to see symptoms last a little longer, maybe more frequent. You visit your doctor, then what he's going to do is keep you on your rescue inhaler, and you'll use that as needed, but you'll add this low-dose corticosteroid. A few of the meds are Alvesco, Becalate, and Foxatide. Signs and symptoms of those are hoarseness, thrush, or yeast that you'll see on your tongue, and that's why you want to rinse your mouth out after you use the inhaler. And don't use a large spacer. It seems to decrease the effectiveness of the medication. And if symptoms, continue to persist, then at this point you'll want to add a long-acting B2 agonist. Okay, so continuing on to treatment. So as asthma begins to progress or is more poorly controlled, we move on to step 4. And as you can see, I've listed there some inhaled corticosteroids. And what happens is you could be using the same medications, but the doctor may continue to up the dose. And at this point, you're at a medium dose inhaled corticosteroid, continuing the long-acting beta-2 agonist, and also carrying that rescue inhaler as you need it. The doctor may also refer to an asthma specialist who specializes in this disease. Then moving to step 5, again, symptoms are getting even worse. Certainly a very concerning factor. So at this point, we've now increased the corticosteroids to a high dose corticosteroid. And remember that, corticosteroids can decrease your immune system, so you need to be careful with that. And also we're continuing a long-acting beta-2 agonist, continuing the rescue inhaler, and the doctor might add this medication called Xolair. It controls severe allergic asthma symptoms not responding to high-dose steroids. Studies have shown that in some cases this medication has caused a very serious life-threatening allergic reaction, but then of course it is definitely approved by the FDA and on the market for use because it does help some people with a severe, allergic asthmatic who's not responding to high-dose steroids. And then, of course, you see number 6. That's really highly uncontrolled or poorly controlled asthma. And at this point, if you have not seen an asthma specialist, it would surprise me. So again, in treatment, remember, it's all about the control, following the doctor's orders with the medications, staying on task with it, not missing a dose, making sure that you're keeping track of whether or not your symptoms are getting better or worse in order to keep it controlled. Okay, so now what we're going to talk about is asthma around the world and here in the US. You probably are aware of at least one person who has asthma and carries an inhaler. It's, a very common disease. 300 million people worldwide have asthma. It's the most common chronic disease in the world. And it can present at any age, as we've discussed, birth, adolescence, or even adulthood. And in children more than males more than females have an incidence of having asthma, but then by the time they get to adulthood, the ratio kind of evens out. Blacks have a higher incidence in the U.S. Allergy sensitivity, of course, increases that, and death is uncommon, but it is still possible when it's not controlled. So key points to remember in asthma is if you feel like you have symptoms or you have had symptoms before and have been diagnosed and you notice that they are getting worse or more frequent, that you connect with your doctor, work with him or her, with a goal, some plans in order to keep your function, in life as best you can, to have the best quality of life, because that is very possible whenever you can keep it under control, taking your medication as prescribed. If your symptoms do increase, using the rescue inhaler more, be sure and call the physician for follow-up. Do not continue using that inhaler, that rescue inhaler, more than 2 times a week. And also, controlling the symptoms is key to living the life that you want and doing the activities that you want. So when you know what those triggers are, if, grass or pollen, or those sort of things, do your best to prevent, inhaling that stuff to irritate your airway and causing, problems, so that preventing that can give you a much better quality of life. Asthma is certainly a disease that many have learned to live with. Thank you so much for your time.